The Florida Society of Clinical Oncology is a Florida state professional society that represents all the healthcare providers that take care of cancer patients. And our overall goal is to ensure that Floridians have proper access to appropriate healthcare. The month of February is Metastatic Breast Cancer Awareness Month. So we're here to discuss metastatic breast cancer, to provide education for patients and caregivers, and as well point out some key legislative issues that the Florida State Legislature will be facing this year.
Basically what that legislation is a doctor will prescribe a medication for a patient, and insurance will say, no, we're not going to okay that one. You're going to have to take this one or this one or this one, and you have to fail first before they will allow you to have the medication that the doctor prescribed for you. In a lot of cases, you're talking a minimum of 3 months of failure before they can actually get on the medication they really need. And that's got to be stopped.
There's legislation that's being introduced this year that will help protect the physician-patient relationship and help guarantee the fact that the physician does have the authority to be able to tell the patient what's best for them, not the insurance companies.
So the way I think of breast cancer is breast cancer starts out in the breast, and the place that it spreads to would be on the lymph nodes first, and secondarily it can spread outside of that. So the way I think of it is local treatment here, systemic treatment there, inside of the box, outside of the box. And metastatic breast cancer really means that it's already left the building, so you don't need just local treatment, but you also need systemic treatment.
Well, there's a lot of focus on breast cancer and early detection, and all of that's appropriate. And most people don't realize that 80% of the women in this country that are diagnosed with breast cancer will be cured with surgery and perhaps some pills, maybe a short course of chemotherapy. The rest of the women, the breast cancer will come back, and then the goals of therapy are different. We can't look the woman in the eye and say, we're going to cure this. So our goal is to administer treatments that don't interfere with their quality of life, but control the disease as long as possible. And we become very, very successful at that.
Only about 6% of women that have breast cancer present with metastatic disease, so it's really a minority up front. However, 20 to 30% of women at some point after having been treated for breast cancer will develop recurrence and eventually metastatic disease. So it actually affects a lot of women that have breast cancer, even if not up front, at some point down the line.
With cancer, it's continuing to grow, and if you're not on the medication that the doctor thinks is best for you, and you have to fail on these other medications first, then you're actually taking a step back. You're not being treated with the standard of care, you're not being treated in the best way possible, so it's not good health care.